They're coming to you because they are looking to have some kind of choice in the same context in which they feel stuck. During the process of intervention, our job is to challenge their presuppositions. It's to challenge their assumptions, it's to challenge their world, and then to see whether an alternate reality can be made possible. Well, the answer is yes, because not everybody lives the life of misery that they say is miserable in the same way. Should I replace them with somebody else, then the other person will have more choices and behavioral responses different from this client who's complaining that they're going through something. So that means what the client is saying is the client's personal story, and there is a possibility to bring change. And change can be brought in by installing new behaviors. Well, behaviors are external. What's internal? Values, beliefs, promises. These are internal. So you have to see whether choice is provided, and then the second is, do they embark on the journey to execute those choices? People don't make those choices because they benefit in some way, or they are too scared, or they believe this shouldn't be done, etc., etc. Well, all these are exploration in the journey of counseling. And all our job is to be curious and to explore as much as we can, as long as we can. When you explore and when you ask questions, then the client opens up to answer. If the client really answers, then they're listening to those answers. When they listen to the answers, they may probably feel the disgust or the heaviness, or maybe they begin to feel choices or alternate realities. Well, at the end of the session, the client has more awareness about themselves, more choices about themselves. Will they apply those choices? We do not know. That's another exploration. Do we want them to apply those choices? That's not my monkey and that's not my circus. So why is it that the client is coming to you for a session? The client is coming to you for a session because they are looking for choices which they don't have in the current context of their life. They're feeling stuck. They're feeling helpless. They're feeling hopeless. They're feeling lack of belongingness. They're feeling I can't contribute here. They're feeling I don't belong here. I don't have value here. That's what they're feeling. And because of that feeling, they want to talk to somebody. Maybe they'll talk to the bartender. Maybe they talk to Uncle John. Maybe they talk to the neighbor. Maybe to God himself. But when every aspect, every aspiration, every ambition, every possession fails, they might come to you. Now the question is, how do you rise to the occasion to have that communication, to hold the space with them without interfering? The biggest problem in therapy or intervention or communication is an interfering therapist. An interfering therapist wants good for the client, don't want good for the client, don't want anything for the client. Be there to ask questions without having an expectation of an answer, expectation of an outcome, expectation of anything. Be there for the client. Can you be there for the client? That is silence, that is empathy. Or is your world bobbling and wobbling and rocking because you want something? You want good for them. You want speed for them. You want healing for them. Can you not want any of these things? Well, that's great presence. The ocean doesn't want anything for you, yet you feel good. And some people come back and say, I felt therapeutic with this walk today at the ocean. But the ocean didn't want anything for you.